Okay, today we're going to talk about Medicare supplements and the 7 questions that you need to ask before buying a Medicare supplement policy. Original Medicare, which consists of both Part A and B, is still the most popular option by Medicare participants, but it still has its limits as to how much of the bill it will pay for. As a result, Medicare supplements were created to provide a way for people to fill in the gaps that Medicare doesn't pay for. A Medicare supplement insurance is a very highly regulated industry. And by law, all companies can only offer the same plans, which are all identified by a letter. All plans with the same letter offer the same benefits no matter which company sells them. There is a difference in premium and underwriting guidelines, though, from company to company. And not all companies offer plans in every state, and not all companies offer all the plans available in every state. So before deciding on a Medigap policy, or even whether to buy this insurance at all, you need to answer several important questions. The first thing is that you should ask is whether you can afford it. And it's hard to know that answer before you know the cost, but if you have very low savings and virtually every dollar in your monthly income is already accounted for, then another question to ask is, am I eligible for other coverage that costs less, such as Medicare savings programs, extra help for prescription drug coverage, maybe Veterans Administration benefits, and Medicaid, which is a federal program that's administered by the states. Those are among the most heavily used programs available to people with low income. Now, second question is, what are my health care costs? Review how much you have spent over each year, say for the last 5 years. If you weren't insured, then include your best estimate for costs that you might have incurred. Now, figuring your real cost isn't necessarily easy, especially if you've had your employer picking up the tab, but try to project future costs as well. Do you think you might need knee replacement, for example, or maybe you've been diagnosed with high blood pressure, or perhaps you have symptoms of diabetes? So be sure to include anything that might be covered by Medicare plans, such as Medicare deductibles, blood, Part A, Part B costs, and other costs that will be your responsibility. Number 3 is, should I get a Medicare supplement if I have a Medicare Advantage plan? Well, the answer is maybe so, maybe not. It depends on your situation. Now, most generally, a Medicare Advantage plan provides all your Medicare-related health care coverage in one package, even including your prescriptions. However, you're going to most likely have limited choices in the doctors you can see and the hospitals you can go to. Number 4, what medical plans best fit my needs? Well, first, you need to learn about the different plan options that are available. You need to choose very carefully, because once you buy a supplement plan, the insurance company must keep renewing it, which is good, but federal law also does not give you the right to switch Medigap policies outside of your 6-month initial enrollment period unless you can qualify physically. Number 5, will my premiums rise? Well, of course they will. Companies hike premiums to keep pace with rising healthcare costs, and some companies charge more for smokers. So be sure to understand how each company rates its policies before you decide, which to buy. Understand how a policy that's cheaper at age 65 might be more costly in the long run if the policy is strictly age-related. And what that means is that the premium automatically increases as you get older. And really, that's the most common Medigap policy that we see. Now, some policies are issue age-related, which means that the price increases are due to factors besides your age, such as inflation. Now, a third method is community rating, which means that everyone living in your area is charged the same rate regardless of age. Under this rating, a younger person might pay more, but a younger or an older person, once they get older, they might pay less than they otherwise would. An issue age or community rated policy might be the best buy in the long run, could be, but before making a final decision, it's very important to check with the company for a history of their premium increases, at least over the last 5 years. Now, that doesn't mean the company is going to follow the same path going forward, but knowing its past helps predict what future rates are going to be. So that's number 6 is, are there issues to consider besides costs? Well, be sure to check your state insurance department for the number of complaints filed against the company that you choose and ask for a comparison with other companies that offer the same plan. Make sure your preferred company has an arrangement with Medicare so that Medigap claims are filed automatically. That's going to save you a lot of time and removes the risk of failing to file a claim, maybe because you're recovering from an illness or an injury. And finally, number 7, ask the question again, can I afford it? So we're back to the original question. Especially if you have limited savings, this is worth paying very close attention to. Medigap insurance, and you don't want to be paying for it and having it depleting your lifetime savings. Medicaid provides an ultimate medical safety net, but it also has what might be perceived as strict income rules and other rules as well. Of course, you can go to all this research on your own, or you can contact someone such as myself at no cost and get some help. You're invited to have instant access to a webinar I've created, which will go over many of the basics of Medicare and most likely answer many of your questions. So just click on the link below before this video ends, and it will take you there. Now, what you don't know can cost you a lot of money. So it's very important to be educated about Medicare. And so this is your chance. You're welcome to view this free webinar right now. You have instant access. Just click that button below. It'll get you to where you need to go, and you can enter as my guest.